a hematoma? So first we form a hematoma, but who can give me our layman's term for that? It is performed to prevent loss of blood, but what actually is it? A bruise? Sort of. Or say it louder. A blood clot. So we form a really big blood clot around the fracture. What's number 2? What do we do after that? What's this? Soft callus forms. What do we call our soft callus? What's it really made of? What is it? Demetrius, do you know? Oh, who knows the real name of our soft
you
callus?
said yesterday.
Fibrocartilage, yes. Now, remember, you can just answer this one out loud. Is a soft callus soft or hard? Soft. Soft, right? Easy. What about a hard callus? Do we think that's hard or soft? What is a hard callus made of, Demetrius? You had your hand up. Zeta, what type of bone? True run. Spongy bone. So then we have a bony callus made of spongy bone. And then what happens? Demetrius. Remodeling. Very good. Who has heard of some diseases, anomalies, anything that can happen to your bones? Tadarius? Perfect. There is a bone disease that causes tenderness, possibly breaking. Sickle cell might mess with your bones. What? Rickets. Very good. Are you saying that because it's right next to you on the wall? Rickets. Anything else? Austin? What? What? Oh, just hold them. Arthritis. Josh? A sprain or a strain. Very good. Is that it? Is that all you ever heard?
I heard.
What do you heard?
Break the bone, so I ain't trying to bleed.
So internal bleeding, bone breaks. I know we just learned about bone breaks yesterday, but that happens, right? That's definitely an anomaly that can happen to your bones. So, number 1, study guides. When's your test again? Tuesday. Next Tuesday. And our study guides optional. No. Yes. If you're not going to be here, you'll do it either before or after. Okay. So, remember, your study guides are not optional. They must be turned in. Nobody's at my door. Sorry. What? I'm giving them to you right now. What is this? Chanter, do you want to tell Demetrius, is your study guide mandatory?
No.
Yes?
Yes.
Is it mandatory? We will keep doing this until you all feel like answering what I've told you before. Is it mandatory? Yes. These are not optional. You don't turn them in. What do you get? Zero. And that's really not fun. I don't want to give them. You don't want to get them, so let's not even go there, right? All right. Today, you are going to be learning about... Sorry. You are going to be learning about diseases, causes, symptoms, and treatments. So, I'm going to pass these out, and then I'm going to explain how to use them. When is your study guide due?
Tuesday.
Next Tuesday.
And so are your drawing notebook.
Perfect. So is your drawing notebook. Do not forget about that. 3 from this 9 weeks. So 3 from this unit. Look at your note. Look at your drawing notebook rubric. We have 8 to 4:30.
Looking.
All right, eyes up here. Eyes up here. Wonderful. This is your graphic organizer that you're using for this. There are 6 stations set up in 2 different spots. As you can see, there are 6 stations over here, and there are also 6 stations on this side of the room. There are 2 sets of them because there are not to be more than 3 people at a station at one time. All right? Stations 1 through 6 have numbers on them. They say disease number, station 6, sprain. And then it gives you the description. You are going to go find sprain on here, and you are going to write the description. You're going to do that with all 6. Does that make sense?
Yeah.
We're going to do something a little different today. I'm going to tell you about it in a second. So what do you need to do first? Who can remind me what I just said? What are you doing first? Demetrius, go ahead. descriptions. You're doing the 6 descriptions first. After that, there are 6 more stations. On this side, there are the back 2 lab benches, and there are 2 on the doors. Once you all get up, I'm going to put the other 6 for this side on desks. Those tell you the causes of one of the diseases, but it doesn't say the name. So you're going to use your descriptions and match that cause. Once you match the cause, you are going to come up with a treatment based on what you think. So if I tell you that I hurt when I move my elbow too much, what treatment are you going to recommend to me? A cast or what? What? A sling, but what? Pain pills. If it's hurting because I'm using it too much, what should I do? Stop using it, right? So, use what you have in your causes and your descriptions and come up with a treatment. Once you have filled out every single block, come show me, and then you will get your practice when you will actually start diagnosing and treating patients. So y'all are going to be doctors again today.
What number 2 at?
Behind Mr. Speed in the back of the room.
What the fuck you worried about?
Shh, really?
What?
First warning for the day.
Don't be
Shush, Demetrius. I'm not telling you you'd be gone, and now you're getting a warning because you keep talking. No, just one. No, you have one. All right. Descriptions, and then you're going to match causes. The causes do not have the name of the disease. You have to match them. So, half the room, go over here and start. The other half of the room, stay over here. Once you all get up, I will place the 6 causes on this side over here. Go ahead. All right, get up. Let's go. For those of you who can't see, station 1 is on the back of the door back here.
No, I'm just saying if I would have said it.
No, I would have said that's your warning. But I'm very proud of you. You're doing very well. Remember, you cannot do your causes until you know all your descriptions yet. Can you put those on the desk right next to you, please? Thank you. Sorry. Turn around. Where's your... I'm proud of you. Good job. You gotta do your notes. You alright? Good job. Oh. Everybody send positive vibes towards Darius. He's having some back pain today. What are you hurting? Okay. Demetrius and Darius need some positive back.
And my thumb.
Maybe what you guys learn about the 2 issues that are on the back here, you can tell them while you treat them. Yes. All of it is descriptive.
Jules, who? What's that? Jules, what?
I explained.
Jules, who?
I know.
I'm just writing on you.
I appreciate you.
Jules, what? Can I write
Do
out?
all the descriptions yet? Okay. Once you do all the descriptions, there are these right here. You're going to read one, and then you're going to match it to what cause it's going to be.